According to the HIMSS EMR adoption rates, only about 2% of the hospitals today have achieved a truly paperless environment. The issue here is that they have very detailed plans, and many of the implementations are actually successful. What we're finding is that there's not a detailed approach and a sustainable approach to the support model that comes after the actual implementation. We're finding that the implementations, there are lots of best practices and they're being very successful, okay? But as I mentioned before, it's not so much the implementation that the major concern is. It's after all the implementation is done, the training is done, it's what happens when a physician needs assistance at 3 a.m. in the morning. It's a support model that there's a huge gap with. In the first 9 months, there's a huge increase in the call volumes into the help desk or service desk as we call it at CareTech. The training is over, but for some reason the clinicians, they cannot remember their passwords, just various kind of support model, training model that didn't work very well for them. They ran through the training. So what happens now is that they have a huge gap in terms of actually carrying out their functions in this new electronic environment. So the support model is increased in the first 9 months and beyond, we're finding in the industry. At CareTech, we have a strong help desk that's already several years experience in this EMR support. So we are positioned very well in the market to take on that aspect of it. What I recommend is that you look for a partner that's onshore, that you look for a partner also that is healthcare specific. You're finding that there are many service providers out there today, but a call taker moves from manufacturing to automotive to healthcare, and that doesn't work very well for physicians and caregivers. You need to find a partner that focuses specifically on healthcare, and they will actually bring best practices and the knowledge that is necessary to provide care to the clinical community.